Good evening, friends. I'm Dr. Aajay Shah, and I'm bringing you another Facebook Live tonight. Tonight, we are going to continue talking about diabetes. We have covered segment 1 to 6, so please scroll down to those videos if you have not watched them. Those segment 1 to 6 are also on YouTube, so if you want to reach out to our YouTube channel, Healthy Living with Dr. Aajay Shah, and watch segment 1 to 6, and then come to segment 7. If you want to watch segment 7, 8, 9 tonight, that's fine. But ideally, you should be watching segment 1 to 6 and then segment 7, 8, 9. Tonight, we are going to cover segment 7, 8, 9. Before I start diabetes, let me give you some update. Uh, we had a great Facebook Live with Chef Aajay last Saturday. We had almost 5,000 views on YouTube, almost 7,000 views on Facebook. So look out for that YouTube recipe. Jayshree, my wife, made pie, mouth-watering, delicious, very tasty, very healthy, no oil, no salt, no sugar dish. So you absolutely would love that. So reach out to that YouTube channel and look for the Chef Aajay recipe. You can type in the YouTube Chef Aajay Jayshree. We also did another live recipe last night on a broccoli soup. We'll reach out to that, look at that also. We're also starting a new program, new project where we will be bringing various guests on our Facebook page as a Facebook Live. So please stay tuned for that. We will start that on this Saturday. Saturday, I'm bringing a great person from Chicago. He's an athlete. He's a very accomplished runner. He's a very family-oriented person. He's a vegan. He practices yoga every day. Very, very wise and very accomplished person. In the evening on Saturday, we'll be also interviewing Jane from California. She's also another accomplished person, a runner, a loving mom, a great social entrepreneur, and just a great person. So we'll be interviewing 2 people on Saturday. So stay tuned for that also. So let's start with our diabetes today. So again, this is segment 7 out of 13. We have done segment 1 to 6. So please watch segment 1 to 6. And we are continuing talk on diabetes and diet. Until now, we have covered the prevalence of diabetes, why diabetes type 2 happens, all the risk factors, pathophysiology of type 2 diabetes, the underlying mechanism why type 2 diabetes happens. Then we started talking about goals with diabetes, particularly the goals with the sugar, goals with A1C, which is the average of a 90-day sugar. And then we started treatment and we covered the medications. And now we are taking this big topic of diabetes and diet. I have covered diet partly in a previous segments. This is continuation of diabetes and diet, segment number 7. So again, when you talk about diabetic diet, I'm a big proponent of low caloric dense food with high fiber. Again, food which has a low caloric density is typically the food which is raw and cooked vegetables without any oil, which has a high fiber. You can have lots of that food, particularly the quantity, and you still will not have enough calories. Our stomach actually has a capacity of about one pound. So we typically eat about 3 pounds per day of diet. If you eat a diet which has about 500 calories per pound, then you eat about 1,500 calories by eating 3 pounds. So again, eating a food with a low caloric density is very important. I will cover the caloric density as we go. I designed this diet. I call Diet of Abundance, which is kind of my own name. So I call it Aajay Shah diet, Aajay Shah diet. It's called Diet of Abundance. It's called Diet of Abundance because you are allowed to eat as much food as you like. You can eat up to you are feeling full and you will not be eating too many calories. So we will design this Diet of Abundance. As you remember from macro calories, carbohydrate gives 4 calories per gram, fat gives you 9 calories per gram, and protein gives you 4 calories per gram. As you can see, as fat gives you more than twice the carb calorie. If you are eating carb diet instead of fat diet, you can actually eat twice the amount and your stomach will full. So again, nature knows what food we should be eating. So it designed the low calorie carb food so you can eat larger food. Again, eating carbohydrate gives you more quantity to eat. Obviously, what kind of carb you eat is very important. It has to be whole food, plant-based food with no oil. Again, raw vegetables, cooked vegetables with water, fruits, nuts, only if your body mass index is below 25, otherwise no nuts, no oil, obviously, flax seeds, one tablespoon, 1 to 2 tablespoons per day, and definitely avoiding or minimizing animal products and dairy as much as possible. Uh, so many times people say that how many grams of carb I should eat per day. So my macro ratio, I explained you before, my macro ratio, my recommendation for macro ratio is 70% carb, 70% carb, 75% carb almost, 15 to 20%, 15% fat, maximum 15% fat, and 10% protein. Again, 75% carb, 75% carb, 15% fat, and 10% protein. So if you count 75% carb, which has to be whole food, plant-based food, again, that means raw and cooked vegetables, fruits, beans, whole grain, all those things will be in the whole food, plant-based diet without any oil. And if you eat about 2,000 calorie diet, you'll be getting about 350 to 400 grams of carb per day. So again, many diabetics think that this is too many carb. Many keto diet, keto proponents propose actually less than 20, less than 30 grams of carb. In my diet, which works, actually I allow 350 to 400 grams of carb, but it has to be high quality carb. It has to be complex carb. It has to be whole food, plant-based food. Again, I keep repeating myself. That means raw and cooked vegetables without any oil, fruits, cooked beans, 1 to 2 cups per day, flax seeds and seeds, chia seeds, and nuts only if your body mass index is below 25. So again, this is the type of diet I want you to eat, and this will allow you to have 350 to 400 grams of carbs per day. No oil is the best option. If you only use small amount of oil, I can understand that. Then use olive oil, avocado oil, or canola oil. But the best option is no oil. Definitely avoid sunflower oil, coconut oil, cotton seeds oil, because all the oils, sunflower, coconut, and cotton seeds oil are very high in omega-6, and obviously omega-6 is a very inflammatory fatty acid, and that can lead to a lot of chronic disease, including worsening of diabetes. So definitely avoid all those vegetables oil. Again, this is a caloric density concept. This concept is very important. I want you to understand. Calorie density concept means how many calories per pound the food provides. So if you look at the vegetables, green vegetables provides about 100 calories per pound. So if one person eats 1 pound of green vegetables without any oil cooking, he or she will get 100 calories per that pound. If you eat fruits, it's about 200 to 300 calories per pound. If you eat starchy vegetables and grains, it's about 400 calories per pound. If you eat beans and lentils, it's about 400 to 500 calories per pound. If you eat more processed, more factory-made food like bread, bagels, fat-free muffins, then it's about 800 to 1,000 calories per pound. If you eat meat like chicken, turkey, fish, seafood, it's about 1,000 calories per pound. If you eat beef, it's about 1,000, 1,100 calories per pound. If you eat a lot of sugars, sugar itself gives about 12 to 1,400 calories per pound. Cheese is very calorie dense. It gives you about 1,500 calories per pound. Chocolate, candies, and pastries, including donuts, gives you about 2,000, 2,500 calories per pound. Bacon, very processed meat, almost a carcinogen, gives you 2,400 calories per pound. Nuts and seeds, like I said, are very calorie dense, and it gives you about 2,400 to 2,500, almost 3,000 calories per pound. And that's the reason I don't recommend nuts if you need to lose weight. So if your body mass index is about 25, you should not be eating any nuts. Nuts are good for you only if your body mass index is below 25. You can have seeds, flax seeds, If your body mass index is about 25, and you will get enough omega-3. And definitely oil gives you the most calorie dense food. Oil gives you 4,000 calories per pound. And that's the reason I want all of you to have no oil as much as possible, or minimum oil. Again, remember, this caloric density concept is very important because we all need to fill up our stomach. That's the only way we get satiety. That's the only way we feel full. That's the only way we get satisfaction of how much food we have eaten. So if you eat low calorie dense food, you'll be able to fill up your stomach with low calories and feel full. So that's very important. This is a very important slide. This slide came from Brenda Davis. Very important slide. People ask me what kind of grains I should be eating. And this is a grain hierarchy. This is very important. We should be eating intact whole grain, And that's typically quinoa and barley. Then you can, next is a cut whole grain, which is a still cut oats. Then rolled whole grain, which is rolled oats. Then shredded whole grain, which is shredded wheat. Then ground whole grain, which is a whole wheat flour, where typically most breads are made. Then flake whole grain, like Kamat flakes. And then puff whole grain, like puff wheat. Puff wheat are one of the most unhealthy grain you can eat. I remember eating some pawa. Many of you know from India what pawa means. It's a puffed rice. Puffed rice gets digested and releases the sugar so quickly. I did a continuous glucose monitoring on me just to see how my sugars are running. When I eat the puff rice, my sugars spike up to 200. So again, what kind of grain you eat is very important. Try to eat intact whole grain as much as possible, quinoa and barley. If you want to eat oats, eat still cut oats. And if you want to eat any wheat, make sure you eat a whole wheat flour and try to eat sprouted wheat flour bread. So again, grain hierarchy is very important. This is one of the bread I like. This is Aziki 49 sprouted whole grain bread. It has only 80 calories. It has a 3 gram of fiber, 4 gram of protein, 15 gram of carbs. So it's a kind of a low carb and has only 0.5 gram of fat. This is one of the healthy bread. You can get it at any grocery store. Again, sprouted whole grain bread. This is the bread we get it at our home. This is type of oats I recommend, highly recommend, which are oat groats. Again, this one has a very high amount of fiber. This one has a 5 gram of fiber in 170 calories. Almost has zero fat, 0.5 gram of saturated fat, zero cholesterol, and has a 6 gram of protein. So again, very important what kind of grain you choose. Choose intact grain as much as possible. Again, eating grain, in my opinion, is allowed for any diabetic patient because, as I explained you before, that our microbiome, the bacteria which thrives in our colon, actually requires all type of different kind of soluble fibers, and grain gives you type of soluble fiber where certain bacteria thrive. So again, to have a healthy microbiome, have a healthy colon gut bacteria, you need all different type of soluble fibers, and that's where whole vegetable, whole food, cooked and raw vegetables, beans, and whole grain comes in. So again, I definitely ask you to have all variety of whole food, plant-based food, including grain. Grain is not prohibited for diabetic as long as you choose whole grain. There was a study done many decades ago where diabetic patients were given all rice diet, all rice. So again, all grain diet had a zero fat, and even that diet reversed the type 2 diabetes. That diet probably was 90% carb diet, but even though there was a high carb diet, it reversed the diabetes. So again, carb is not the enemy, it's a type of carb you eat. I definitely want you to avoid any kind of white rice, white flour, any kind of sugar, obviously. All those things should be avoided by all means, not only for diabetic, but for everybody. Let's talk about fat. A small amount of poly and monosaturated fat should be taken, and that can come from small nuts and avocado, particularly if your body mass index is below 25. If you eat just 1 tablespoonful of flax seeds, you will get enough omega-3. You don't need more than that, particularly if you are not having any oil. If you don't have any vegetable oils in your diet, or if you have no oil in your diet, typically your omega-6 is very low, and you don't need that much omega-3. It's the omega-3 to omega-6 ratio which is very important. I had checked my ratio, and because I don't eat any oil and I take 1 tablespoon of flaxseed, my ratio was perfect. So again, you don't need too many seeds as long as you're not eating too much oil. Definitely no trans fat, and saturated fat should be very low. Saturated fat should be less than 10 grams per day. Uh, Definitely limit the trans fat to less than 1% of your daily calories. For someone with a 2000 calorie, this is about 2 grams of trans fat, 2 grams of trans fat, just 2 grams of trans fat. So let's see where the trans fat comes from. Uh, these are the problem associated with trans fat. Trans fat causes inflammation, which can cause many issues, including aches, pains, and swelling. Trans fat causes insulin resistance, which will make type 2 diabetes and make type 2 diabetes worse. Uh, it can also cause many heart problems, including heart attack. It affects your cholesterol. It lowers your HDL, increases your LDL. So definitely, trans fat can affect your cholesterol. Trans fat can affect your microbiome also, which we'll talk about it. So again, trans fat has many complications, many side effects. By all means, trans fat should be avoided. Fortunately, we have a law now that trans fat is prohibited in any diet. As at the same time, there is a loophole in the law that if a trans fat is less than 0.5 gram, the food label can say 0 gram of trans fat. Again, remember, if the trans fat is less than 0.5 gram, the food label can say it's less than 0 gram of trans fat. And if you add up many of the food items with small amount of trans fat, the total trans fat could be very high. And I'll show you that this is the reason Americans get 3 times more trans fat than recommended. So Americans get about 5.8 gram of trans fat, and there should be no more than 2 gram of trans fat. So again, Americans get about 3 times more trans fat than what is safe. Again, Americans get about 3 times more trans fat than what is safe. So where do we get the trans fat? Trans fat comes from cakes, cookies, crackers, and pies. That's where 40% of our trans fat comes from. Margarine provides a large trans fat. Fried potatoes, potato chips, household shortening, salad dressing, breakfast cereal, candies, and then animal products. Many animal products have natural trans fat, so all those things should be avoided as much as possible. Definitely we as American are eating too much trans fat. My trans fat is probably very low because I don't eat any animal products. I have a rarely cakes and cookies. We don't use any margarine. We typically don't eat any fried potatoes or potato chips. So again, I don't use even salad dressing. I did not have cereal for breakfast cereal for last 3 years. So my trans fat probably is less than one gram per day. Again, you should be all watching out all the food for trans fat and avoid trans fat as much as possible. So these are some of the common food with high in trans fat: French fries, cheeseburger, pies, donuts, ghee, and chicken nuggets. There are many other foods, but these are the common foods you should be avoiding. You should be watching out to make sure you don't get too much trans fat. If whenever we go to sugar, we have a whenever we go to restaurants or a coffee shop, there are free sugar pack, free sugar substitute, free creamer. And if you ask for milk, there's a free milk added to your coffee or tea. So again, all those things which are extremely bad for you are free. But let me tell you, those things are not free. On the long run, they're going to cause many health issues, and none of them are free. If you ask for soy milk, which is very healthy, they charge you extra. So just imagine the restaurants and coffee shop giving you free things, quote unquote free things, which are very unhealthy for you, and charging you which are healthy for you. Again, sugar, free sugar, in my opinion, is one of the biggest reason people keep adding sugar to their coffee. They add sugar substitutes, they add creamers, which is very unhealthy. This is, again, an example of an American food plate. So you can see that American food plate has a dairy as the drink, dairy as a beverage, which in my opinion is definitely not the right recommendation, but this is our American plate. I'll show you Canadian plate in a second, but American plate recommends dairy as a beverage. In my opinion, the beverage should be water, not Coke, not Diet Coke, not Pepsi, not juice, not dairy. It should be water. And plate should be full with vegetables, fruits, grains, and protein. So again, all those types of food are very important in our plate. But let me show you the plate, which actually not only a more proper, description and picture of the plate, in my opinion, a better healthy plate than an American plate. And that plate just comes only 100 miles north from where I live. That plate comes only 100 miles north from where I live. So you can imagine the two different recommendations between just two neighboring countries. And this is a Canadian food plate where again the beverage of choice is water. You can see the plate with a lot of fresh vegetables, a lot of cooked vegetables, very minimum grain, which are whole grain, and you can see the picture. And protein also has a large share of plant-based protein. There is some meat, there is some dairy, but it's mostly plant-based protein. So again, this Canadian food plate, in my opinion, is much more healthier than American food plate. So if you want to see any example, if you want to have any example in your house, on your phone, then this is the plate I want you to save. Again, Canadian food plate, not American food plate. If you have a if you take 1 ounce of nuts, this is just an example. If you take 1 ounce of nuts versus if you take 1 pound of steamed potato will make you full, will give you same calories. And steamed potatoes are much low in the fat. And as we covered in our previous segment, it's the fat in the cell, fat in the muscle cell, fat in the liver cell, fat in the pancreatic cell, which causes type 2 diabetes. So we need to eat much lower fat. I should say that we should not be eating more than 15% of our calories from fat, and possibly even less than 10% calories from fat if you have type 2 diabetes. And I'll cover extensively why fat should be less than 15% in my previous segment. So please watch those previous segments. If you know the keto diet recommends 60% fat calories, 60% fat calories. In my opinion, that's not the healthy recommendation. And many keto people actually we will have a worsening of insulin resistance. Their sugar may come down, their A1C may come down, but their insulin resistance underneath will keep getting worse. Definitely, we all also know that you cannot exercise to overcome a bad diet. People say that I had a donut, so I'll exercise, but to metabolize and to burn one donut, you need about 2 or 3 hours of walking. Nobody does that. Everybody eats donut in the morning and never walks in the evening. So never expect and never hope that you will exercise to overcome a bad diet. At the same time, I also must say we cannot go hungry too long. So if you start cutting calories, if you start going on a starvation diet, if you start having only one meal a day, it will be very hard to sustain long term. We all need to eat food, but like I explained you, we need to eat low calorie dense food. And vegetables, fruits, and beans gives you low calorie dense food, so that way you can eat 3 meals per day, feel full, and still not gain weight and start losing weight if you're overweight. So again, this is a slide, I took it from my other talk. These are the side effects of animal-based products. I'm not asking you, all of you, to go become vegan like I am, but I definitely want you to be aware that animal-based products should be less than 10% of your calories. So again, animal-based products should be less than 10% of your calories. Animal protein raises IGF-1 level, insulin like growth factor 1 level, which has been found to cause many cancers. Eggs also have been caused to cause the type 2 diabetes. Processed meat like bacon, hot dogs, salami are class 1 carcinogen. So eating bacon is as bad as smoking. Eating bacon is as bad as smoking. So I definitely ask you not to eat bacon ever again. Red meat also is a class 2 carcinogen. Avoid red meat as much as possible. Obviously, if you have a red meat or steak once or twice a month, I can understand, but definitely not red meat on a daily basis. Many people, many patients I see, many friends, American friends I know, even many Indian friends I know, they have an animal product all 3 meals of a day. They may have a bacon or an egg for breakfast. They may have a chicken sandwich or a burger for the lunch, and they may have fish for the dinner. So they have all 21 meals have some animal products. In my opinion, animal products should not be more than 2 or 3 or maximum 4 meals out of 21 meals. The people who live long, the blue zone people like Okinawa, many of the blue zone people, their animal products are less than 10% of calories. So try to have large amount of vegetables and fruits, raw and cooked without any oil, and minimize the animal products. Animal products also have a lot of saturated fat and cholesterol. And as we talk, saturated fat not only cause type 2 diabetes, but also heart disease. Same with cholesterol. Cholesterol also can cause a lot of heart disease. Animal-based products contain choline, which can lead to production of TMAO, which can lead to inflammation and heart disease. Animal-based products contain heme iron, many of you are aware of it, which can also cause a high risk for heart disease. Dairy definitely now has proven to be causing breast cancer, and many women don't realize that eating a yogurt, a low-fat yogurt, also can cause breast cancer. So definitely avoid dairy as much as possible. Again, cheese, one of the most addicting food, one of the most favorite food of many people, is one of the worst food. In my opinion, cheese is as bad as beef. Cheese has salt, saturated fat. Cheese is very calorie dense. Cheese has cow estrogens, and cheese has no fiber, just like red meat. So again, cheese is as bad as red meat. If you have cheese once or twice a month, I can understand, but not 4 times a week, 5 times a week. So avoid cheese as much as possible. Again, I don't want all of you to go vegan, but avoid the animal products, no more than 10% of your calories. This is again continuing the side effects of animal-based product. Animal-based products also promote formation of advanced end glycation product, which has been implicated into many diseases, including heart disease, Alzheimer's disease, diabetes, skin wrinkles, and even reducing the longevity. Again, this is advanced end glycation product. Animal-based products and protein is also detrimental in a lot of people with kidney disease. Animal-based products also can cause gout and raise the uric acid level. So avoid animal-based product as much as possible. Definitely not more than 10% of calories from animal-based products. Let's cover the role of keto. Keto diet, in my opinion, is one of the fad diet. That means it has come and it will be gone. Keto diet right now is the most popular diet in America. Keto diet is the most popular diet in America. I researched and read all the data on keto diet, on low carb diet. Low carb diet may lower your fasting glucose and A1C because you are not eating sugar or eating carbohydrate. So your insulin will come down. You will have a low sugar level and low A1C level. But underneath, your insulin resistance will keep getting worse. I'll explain you extensively how insulin resistance happens, including role of fatty acid into the muscle cell, liver cell, and pancreatic cell. And if you eat keto diet, which has a 60% fat, calories, it will definitely make your insulin resistance worse. And many keto diet, when they're given even a small amount of carbohydrate, like just one banana, the sugar spikes up because underneath they're very insulin resistant. Many keto patients, when they have a glucose tolerance test, their glucose spikes up also. So again, keto diet may improve your blood sugar, may improve your A1C, but underneath, the insulin resistance keep getting worse. In general, I advise against keto diet. I definitely don't want you to eat simple carb like white bread, white rice, processed carb like sugar, cookies, cakes, etc. But definitely, I want you to eat the high carb diet, which is a whole food plant-based diet. Again, for me, the macro ratio should be 75% carb, 10 to 15% fat, and 10 to 15% protein. But all carbs should be whole food, plant-based, no oil carb. Again, there was some study done in mice when they took the low carb, high fat diet and insulin resistance got worse. So again, if you understand the underlying mechanism of insulin resistance, you can start to realize that the high fat, low carb diet, which is the keto diet, will cause the worsening of insulin resistance. Again, like I explained, glucose tolerance test in keto diet, sugar spikes very high. Even eating one banana on the keto diet spikes the sugar very high. So keto diet definitely is, in my opinion, no. Keto diet doesn't have a long-term data. Longest data is about 2 years, and long-term data on health is also not there. Keto diet can change your cholesterol, can raise your LDL, so definitely higher chance of heart disease. So I definitely don't want you to think that keto diet has been around for decades. Whole food plant-based diet has been around for not just centuries, but for millennia, for thousands of years. And that diet, in my opinion, is one of the most healthy diet. A lot of blue zones where people live up to 100, eat whole food plant-based diet with no oil and with beans. So again, keto diet, in my opinion, is a fad diet. It has come just like Atkins diet came in 80s and 90s and was gone by early 2000. Keto diet is also a diet which has come for 10, 15 years, and keto diet will be gone. Just like Atkins diet is gone now. Keto diet, in my opinion, also is a kind of a low energy diet because your muscle glycogen is very low. So in my opinion, keto diet, I don't recommend. You can make your own judgment. You can look at all the data. You can read all the articles. You can read all the books. You can watch a lot of YouTube videos. You can watch keto proponents on YouTube, and I'll give you the names of them. But then I want you to make your own judgment, your own decision, whether you want to go for a keto diet or you want to go for whole food, plant-based, no oil diet. Again, make your own judgment. This is a keto macro ratio. Again, you can see that fat is almost 60 to 70%. Fat is almost 60 to 70%. Carb is only 5%. Carb is only 5%. You can understand this high amount of fat, how bad it can cause insulin resistance. If you remember the mechanism I showed you in my previous segments about insulin resistance. If you're not watched the previous segments, please watch segment 1 to 6. They're already on YouTube. So watch segment 1 to 6. This segment will be on YouTube by tomorrow, so you can watch it again if you need to. This is a very important slide, a little complex to understand, but what it shows that when your energy from carbohydrate in percentage and your hazard ratio, or your essentially your mortality. So when the carb is between 45 and 60, you have the best health. When your carb goes below 20%, your health starts to suffer and mortality goes high. Again, this slide came from an European meta-analysis where it showed that the carbohydrate should be minimum 50%, possibly around 45 to 60%. In my opinion, carbohydrate should be around 70 to 75% whole food, plant-based carbohydrate with no oil. But definitely when you go carbohydrate below 20%, your mortality starts to go up. You start to live less. Keto diet recommends 5% carb, which obviously is going to be very, very lethal, very, very high mortality. So in my humble opinion, no keto diet. Look at all the data yourself and make your own judgment, make your own decision. So again, there is a concept called carb to insulin ratio. This is an important carb to understand. It mostly applies to the people who are on insulin, whether they are type 1 diabetic, type 1.5 diabetic, or type 2 diabetic on insulin. And this ratio explains that how much carb you eat and how much insulin you need to inject. So for example, if somebody eats 300 grams of carb, 300 grams of carb, and they have to take insulin 60 units, that carb to insulin ratio is 5. 300 divided by 60, carb to insulin ratio is 5. If somebody eats 300 grams of carb and they have to take only 30 units of insulin, the carb to insulin ratio is 10. People who are on whole food plant-based diet, their carb to insulin ratio is very low. That means their insulin sensitivity has improved. So again, remember this carb to insulin ratio. I've seen many patients with type 2 diabetes when they go on whole carb plant-based food, whole food plant-based food, their carb to insulin ratio goes down. I have a patient right now who I'm helping to manage. She has gone whole food plant-based diet, She was on insulin about 200 units per day. Now she's already down to 70 units per day, and her carb in the diet has almost double or triple. So carb to insulin ratio has significantly improved because her insulin sensitivity is improving. So again, understand this carb to insulin ratio. So I want you to eat more healthy carb, and hopefully that will lower actually your need of the insulin. And I've proven it again and again in many patients. So try to understand this carb to insulin ratio. Look it up on YouTube, look it up on the Google, and read as much as you can about carb to insulin ratio, particularly if you're type 1 diabetic or if you are type 2 diabetic on insulin. Again, this concludes this segment. Let's quickly reflect. What do you think of keto diet? I already explained you the good and not good of keto diet. I explained you how insulin resistance happens. So I want you to make your own judgment. And what do you think of the keto diet? Do you think that high amount of saturated fat in keto diet will cause insulin resistance worse? So again, understand the mechanism of insulin resistance. And what do you think the ideal macro ratio in the diet should be? Do you think the macro ratio should be high carb, low fat, or it should be high fat, low carb? Again, make your own judgment. And again, no, do you eat any foods with trans fat? I gave you the list of all the food which has a trans fat. Make sure you know the list and know how much trans fat you are eating. And the last question is, how much processed food do you eat? How much processed food do you eat? Processed food has been 65% of American calories. 65% of all calories come from processed food. Not mine, but most Americans have 65% calories come from processed food. And processed food is the reason obesity, type 2 diabetes, many chronic diseases have happened. This again brings us to a slide. We are starting this coaching program from July 1st. So if you are interested, reach out to me, text me, and we will be able to connect with our health coach. And it's very cost-effective program. This concludes segment number 7. We will go to segment 8. If you have not watched segment 1 to 6, please watch segment 1 to 6 on YouTube. We will go to segment 8. Again, this starts the segment 8. We'll be covering segment 8 and segment 9 tonight. And this is a 6-week plan to reverse the type 2 diabetes. So if you have type 2 diabetes, and if you follow this 6 weeks of plan, I can assure you, I can pretty much guarantee you that you will be off insulin almost. You definitely will be off many expensive medications, and you possibly could even reverse the type 2 diabetes. So what is this 6-week plan? This 6-week plan, the page came from Dr. Joe Furman, one of my favorite mentor, Eat to Live book. If you have not gotten this book, I highly recommend to buy this book. It's only $10 on Amazon. I'll show you how to get it. Again, the name of the book is Eat to Live. And this book has a 6-week plan where it makes you lose weight rapidly if you are overweight. It reverses your insulin resistance. It starts with unlimited food, which is typically raw and cooked vegetables, 1 to 2 cups of bean, fresh fruits, and then it limits you certain type of food. Again, this is page 216 in Eat to Live book. I highly recommend all of you to get this book called Eat to Live. And it definitely has off limits or minimum as much as you can with dairy products, animal products, no snacks, no fruit juice, and no oils. Those should be avoided as much as possible. If you are very serious about reversing type 2 diabetes, those should be, in my opinion, completely eliminated from the diet. This is the book on Amazon. Get a used copy. You can get it for $10. Eat to Live. I sold this book to many of my patients, many of my friends. I actually used to keep a copy to give it out to the friends, price to price. But now I just tell them the name. I have a copy of the front of this page, and I just hand out them the copy. And many of my patients, probably, I would say at least 300, if not 400 patients have gotten this book, and they all have thanked me for recommending this book. I highly recommend to buy this book today if you can. Only $10 on Amazon. Fasting is also very important. Fasting not only reverses insulin resistance, but also help you to lose weight. 24-hour water-only fast is best, but it's much harder. If you have diabetes and if you're on diabetic medications, including insulin, 24-hour water-only fast becomes a complex issue because your sugar can drop. So I typically don't recommend 24-hour water-only fast, but you could, under your doctor's supervision, can do a water-only fast. You can do once a week or once or twice a month, and that will definitely help you to reverse the insulin resistance and lose weight. But I think this, in my opinion, should be a second line. First line should be intermittent fasting. If you want to do water-only fast, definitely make sure you do under your doctor's supervision, because your diabetic medications may need to be whole. The type of fast I recommend is intermittent fasting, where you have a 12 to 16 hour of no eating window. 12 to 16 hour of no eating window. Intermittent fasting is a kind of a new thing about last 5, 7 years, 10 years. It has a lot of benefits, but you create a window of no eating 12 to 16 hours. It has a significant benefits, including weight loss, better sleep, better cholesterol, even reduction of blood pressure, reduction of cancer. It promotes autophagy. It even increases in longevity. It reverses insulin resistance. It makes type 2 diabetes better. So definitely I want all of you to consider intermittent fasting as much as possible. I typically eat probably within 12 to 14 hour window. So typically I would advise you to eat breakfast around 7 or 8 o'clock and then not eat any meal after 5 or 6 o'clock in the evening. So that will give you about 12 hour of window. If you can make a window 14 to 16 hours, that would be the best, but 12 hours should be minimum. Nighttime eating definitely should be avoided as much as possible. The supplements I recommend for type 2 diabetic is the amla, which is the Indian gooseberry, which has shown some benefit in insulin resistance. Chromium, vitamin D, and B12. I recommend B12 for all vegans, and definitely even I recommend B12 for pretty much every American, because B12 deficiency is very common in America. Vitamin D, if you're not getting enough sunlight, cinnamon, ashwagandha, giloy, berberine, and I definitely ask you to get many micronutrients from vegetables and fruits, and a multivitamin if you're not getting enough vegetables and fruits. In terms of alcohol for diabetic, zero alcohol is ideal. Alcohol, I have a separate talk on alcohol. Please look me up on the YouTube. So in my opinion, alcohol should be zero as much as possible. But if you enjoy drinks here and there, then avoid high caloric drink like beer, wine, mixed drinks with sugars. Try whiskey, bourbon, vodka, which has a low calorie. But again, those should be no more than one drink once or twice a week. Definitely avoid drinking 3 or 4 drinks at a time. Alcohol has a 7 calorie per gram, so alcohol definitely packs more calorie. Alcohol definitely is considered empty calories, and many times when people drink alcohol, it comes with a lot of unhealthy food. Nobody eats broccoli with a beer. Most people eat chips or fries or pretzels or pizza with beer. So again, alcohol comes with many times a lot of unhealthy food. So alcohol should be avoided as much as possible. Next is the stress management. Definitely stress plays a large role in terms of our appetite control, chronic inflammation, and it can also raise your sugar and A1C. Depression is a major risk factor. And depression not only can cause type 2 diabetes, but people with type 2 diabetes also have a higher chance of depression. So again, depression can be both cause and effect of the diabetes. Stress management, again, is very important. Use different techniques, including meditation, including social support, but do everything to lower stress management as much as possible. And also definitely stay in touch with your doctor if you need to go on antidepressant. Relationship is also very important. It's one of the important pillars of healthy lifestyle, and definitely spouse or life partner, family, and friends, and they all support you with your type 2 diabetes, with your type 1 diabetes. Relationship also helps to lower the stress. It provides a support and outlet when you're dealing with type 2 diabetes or type 1 diabetes. You should also find friends and family members who have diabetes and make a team to reverse the diabetes and how to get the best results for diabetes. So again, relationship is very important when you take care of diabetes. Role of family in the management of diabetes. I think as a family, we cook together, we eat together. So if you have diabetes, your family will also need to change what they eat, because if they're eating unhealthy white rice, white bread, sugary items, then obviously you'll be tempted to eat. So you will need to make a plan for the whole family if you have diabetes. Remember to check sugar and take meds. So again, your family can remind you to check the sugars and take your medications. Your family can also watch you for hypoglycemia. Your family can help you to exercise together. Your family can also help you to do grocery shopping together. So again, family support is very important in management of diabetes. So definitely discuss with your family, discuss with your spouse, discuss with your kids, see how you can manage your diabetes. Sleep is very important. Sleep deprivation, particularly less than 5 hours, you have higher chance of obesity, higher chance of pre-diabetes, and worsening of diabetes. So again, sleep is very important. Try to get at least 7 hours of sleep. People who sleep poorly develop insulin resistance. They have higher chronic inflammation. There's a data that beta cell in pancreas, which secretes insulin, also regenerate during sleep. So sleep is very important. We all need 7 to 8 hours of sleep every night. Watch a separate sleep video I have on YouTube if you have a poor sleep. Again, I have a separate video on YouTube on sleep. Please watch that video. That video is about 15-20 minutes long. But if you watch that video and if you employ all the techniques, your sleep will definitely improve. Exercise is very important when you have diabetes. Exercise increases glycogen synthesis in the muscle cell, and that increases insulin sensitivity, and your type 2 diabetes will get better. Before you start your exercise program, make sure you have an evaluation by your doctor that you don't have any serious heart blockage before you start exercising, particularly if you have type 2 diabetes. I recommend cardio type exercise where you raise your heart rate. I definitely recommend 10,000 steps per day. Obviously, start small, start with 3,000 to 5,000 steps per day and build up to about 10,000 steps per day. I also recommend weight training because weight builds a muscle mass, and muscle is obviously the biggest utilization of sugar, and that also improves the insulin sensitivity. So I definitely recommend all of you, particularly after age 50, some weight training, whether with the free weights, machine weights, or body weights, which is a calisthenics. I also recommend stretches on a regular basis. I also recommend walking after a meal, particularly after a large meal, because when you walk after a meal, I'm not asking jogging or running, just a stroll, just a simple walk after a meal prevents the sugar spikes and improves the insulin sensitivity. So again, walking after your dinner is a good idea. I every day walk after my dinner. I walk at least 1 hour after my dinner every day. If you start your exercise program, make sure you watch your sugar often because your insulin sensitivity will improve and your sugar will start coming down. And I don't want you to be hypoglycemic. So if you start any exercise program, make sure you check your sugar often, and you may have to cut down on your medications. But again, exercise is a very important part of taking care of diabetes, particularly type 2 diabetes. Let's talk about eating at the restaurant. Many of us like to go out. Obviously, I prefer eating at home as much as possible. Lately, because of this COVID-19, we've been eating at home. But when the restaurants open up again, I would definitely want you to eat at least 18 meals homemade and 2-3 meals outside a restaurant. We all enjoy going out, socializing, having some small fun, but avoid restaurant meal as much as possible. If you have to go to restaurant, this is what I recommend, that choose a restaurant where there are healthy options. Find a place where you can sit down, mingle, socialize, talk, but go to a restaurant which has a healthy option. Definitely avoid fast food as much as possible. Pick a vegetarian option with a no oil, pick a whole bread, pick any kind of dish which has a low calorie dense food. If you are ordering any soup, order a soup without any kind of oil or any kind of cheese-based soup. Avoid high-fat items as much as possible. If you enjoy any animal products like a meat, definitely order grilled fish or grilled chicken as much as possible. Again, when you go to a restaurant, be very mindful, be very smart, and avoid any meal which is high calorie dense food. That means a lot of calories per pound, and avoid any kind of sugary meal. Instead of having a sugary dessert, have a fruit or just let go the dessert completely. Eating at the parties, I think many times we all socialize, we go to friends' house, we have a Christmas party, we have birthday parties. Before you go to party, definitely preload. Before you go to the party, preload at home. So have a vegetable, have a salad, or have a fruit, or have a large glass of water before you enter the party place. If you do that, obviously you will be feeling full, you will not be hungry, and you will not make unhealthy choices. Again, preload from home. Many of our friends do that. Matter of fact, our a good friend, dietitian Mosmi, has taught Jayashree, my wife, and myself that before you go to party, have a salad at home, have a fruit at home, or have a large glass of water before you go to party. Offer to bring a healthy dish to the host. That will also give you an option of healthy dish at the party, and your guests will also enjoy healthy food. Reach out for healthy options. Definitely avoid any kind of sugary alcohol drinks. Definitely avoid any wine or beer. If you like your alcoholic drink, go for a hard liquor like scotch, whiskey, or bourbon. Obviously, no more than 1 drink, maximum 2 drinks during the evening. Avoid simple carb and high-fat items as much as possible. If you have time left, walk after the party. Like I said, walking after a heavy meal prevents sugar spikes and improves insulin sensitivity. During the party, drink water as much as possible. That will keep you full and will prevent you eating unhealthy choices. And definitely, when it comes down to dessert, have the fruits as a dessert and avoid all sugary dessert, definitely all the cakes and pies as much as possible. So again, parties are fun. I like to go to parties, but be smart when you go to parties, when you go to restaurants, because your diabetes requires 24/7 care, 24/7 vigilance. You cannot drop your guards when you go to parties or when you go to restaurants. Again, this is a very important few words: environment versus willpower. Many of us rely on our willpower, but willpower is actually just like muscle. It gets fatigued. And I've been reading recently a books on willpower. I'm actually preparing a talk on willpower in about 4 to 6 weeks, how to increase willpower. That talk will be about an hour or two long, how to increase your willpower. But again, to give you summary right now in 2 sentences, willpower gets fatigued as the time goes. At our work, at our home, at our school, in our college, we keep using our decision-making things. We get decision fatigue, and with that decision fatigue, our willpower goes down and down. When we come home in the evening after a long day at work, our willpower is depleted, and we will reach out for very unhealthy choices. That's where I don't want you to rely on your willpower, but rely on environment. I read many books on this topic, environment versus willpower. Creating a healthy environment eliminates to rely on a willpower. How can you create a healthy environment? So again, clean out the pantry. If you don't have certain things in your pantry, then you don't have to rely on your willpower to make the healthy choice. Remove all the oil, remove all the animal products, remove all the sugary products, remove all the processed food, remove all the chips. If you remove this thing from your pantry and throw it away tonight, tomorrow, then you don't have to worry about relying on your willpower. Like again, I said, at evening at 6 o'clock, our willpower is mostly depleted, and we make a lot of bad choices. And if your pantry is full of those unhealthy items, then your willpower will not protect you. You will reach out for those unhealthy choices. But if you have environment which is a healthy environment, then you will not have those items to eat. So remove those things from your pantry. Also on your kitchen counter, put fruits and vegetables as much as possible. So when you're hungry, you reach out for fruit. Don't put cookies in a jar in your kitchen counter, because when you're hungry, your willpower will be low in the evening and you reach out for cookie instead of reaching out for a fresh fruit. Clean out your refrigerator. Definitely remove all dairy as much as possible. Again, I don't want you to go on vegan, but remove all dairy as much as possible. Definitely, I don't advise anybody to eat cheese more than once or twice a month. Like I said, cheese is as bad as red meat. Remove all non-complex grain products from the refrigerator, including white bread, any kind of bagels or anything like that. Remove all animal products as much as possible. Again, 10% calories should come from animal products. Definitely remove all juice, all soda, all energy drinks from your refrigerator. Nobody should be drinking juice, soda, or energy drinks. Definitely no. And then fill your refrigerator with the fresh and frozen, no sodium vegetables and fruits. Fill your refrigerator with the water so you can have a chill water. Fill it with a sprouted whole grain bread like I showed you earlier. Fill it with the soy milk with the calcium. This is the way your refrigerator should be full. So again, create an environment so you don't have to rely on your willpower. This is a refrigerator it should look like if you have type 2 diabetes, if you have any diabetes. You can clearly see a lot of fresh vegetables, properly packed, a lot of fruits. This is the way it should look like. This is another example of the refrigerator, which it should look like if you have type 2 diabetes. A lot of fruits, a lot of vegetables, almost like in a rainbow refrigerator. Let's talk about paleo diet. Paleo diet, to sum it up, in my opinion, again, is another fad diet, like a keto diet. Paleo has come, paleo will be gone in 10 years. People recommend paleo because that's how our ancestors ate before the grain came 10,000 years ago. But let me tell you, the current paleo is way different than ancient paleo 15, 20,000 years ago. Current paleo recommends a lot of animal products, lot high protein, lot of saturated fat. Ancient paleo diet was mostly plant-based. And the reason I know, because when ancient paleo diet was analyzed before 15,000 years, that diet had 100 grams of fiber. And to get the 100 grams of fiber, person has to eat almost 3 to 5 pounds of vegetables and fruits. So if the person ate 3 to 5 pounds of vegetables and fruit, the stomach must be full with vegetables and fruit, and they probably ate very small amount of meat. So just based on science, based on evidence, I can prove it to you that ancient paleo, before 15,000 years, ancient people did not eat animal products 3 times a day. They had animal products maybe 2-3 times a week, sometimes not even for the whole weeks. So they were more gatherers than the hunters. Again, they were more gatherers than hunters. Again, Ancient paleo diet was mostly a plant-based, whole food plant-based diet. So if you want to go on a paleo diet, go on an ancient paleo diet, not on a current paleo diet. Current paleo diet is very unhealthy, very high in protein, very high in animal protein, which I already showed you what are the bad effects of animal protein, very high in saturated fat. So again, don't go on current paleo diet. If you want to go on a paleo diet, go on an ancient paleo diet, which was more of a gatherer diet, not a hunter's diet, with lots of plant-based food, lots of fruits, some seeds, and definitely no grains. So again, if you like paleo diet, go on a ancient paleo diet. You can look it up on online. You can look it up on YouTube, the ancient paleo diet, and you realize that ancient paleo diet was way different than current paleo diet. I do not recommend paleo diet. This ends the segment 8. We will go to segment 9 tonight. Again, this is our coaching program. If you are interested in our coaching, please reach out to me through Facebook or just text me on my cell phone, 517-214-9119, and we will reach out to you. Again, this brings us to segment 9. So what other medication you should be on if you have diabetes? Aspirin is one of the recommendations. Talk to your doctor to see whether you need to be on aspirin or not. Statin is a cholesterol lowering medication. Many diabetics, actually all diabetics, will need to be on statin. Obviously, talk to your doctor whether you need a statin or not. If you have high blood pressure, if you are diabetic, certain medications have shown benefits, including ACE inhibitor and ARB. Talk to your doctor, obviously. Again, all the medications should be discussed with your doctor. If you have diabetes, ask your doctor what other beneficial medication you should be on. Let's talk about reversal of type 2 diabetes. This is my favorite topic, and this is something I'm going to keep pushing hard to help all my followers, all my patients with type 2 diabetes, how to reverse the type 2 diabetes. So to reverse the type 2 diabetes, if you lose weight and if you get your body mass index to 22, I can pretty much assure you, I can pretty much guarantee you, good chance, I would say more than 95% chance your type 2 diabetes will be gone. So again, if your body mass index is about 22, try to get your body mass index below 22. That means losing weight. If you lose 15% of your body weight, 15%, just 15%, your type 2 diabetes can be almost reversed. So that means you have to have less than 10 to 15% fat in your diet. You should be cutting calories by 500 calories per day. That means typically eating about 1,500 calories per day and losing about 1 pound per week. Some people will lose 2 to 3 pounds per week. As long as you are feeling full and you're eating adequate fruits and vegetables, you can lose more than 2 pounds. If you are heavy, if you are more than 300 pounds. But typical weight loss I recommend is between 1 and 2 pounds per week. Definitely removing fat from all the cells will reverse the type 2 diabetes. I explained you the mechanism of insulin resistance, and that's a fat in the cell. So if you remove the fat from cells, you will reverse the type 2 diabetes. So you need to lose only about 15% to reverse the type 2 diabetes. So to give you some good news, a person who is 200 pounds lose only about 30 pounds, type 2 diabetes can be reversed. Only about 30 pounds. So again, if you are 200 pounds, if you're type 2 diabetes, if you lose 30 pounds in like 6 to 8 months, your type 2 diabetes can be gone. Your insulin can be gone. So this is very doable, not very difficult. It just requires some discipline, requires some knowledge, requires some planning, requires some coaching, requires some hand holding. And I'm here to help you to reverse your type 2 diabetes. This is my mission. I don't make any money out of it. This is something I want to help. This is my volunteer work. This is my community service. So join this movement and reverse the type 2 diabetes. People who go through bariatric surgery, they reverse the type 2 diabetes very quickly in 2 weeks. Actually, you can reverse the type 2 diabetes with the diet. You don't have to go through bariatric surgery, which is very extensive, very major surgery. Obviously, bariatric surgery, quote unquote, is an easy option for a patient because they don't have to do daily discipline. But again, that's a major surgery. The mortality is still about 3 to 5%, and many people have complications. So prevent or avoid the bariatric surgery as much as possible. Let's talk about how the diet works to reverse the type 2 diabetes. There was a study done called Counterpoint study where people were given 600 calories per day. Very difficult to do, but this study was done and it shows significant reversal of type 2 diabetes. You don't have to go through this extreme of eating 600 calories per day. If you eat just 500 to 1,000 calories less per day than your requirement, you will start losing 1 to 2 pounds per week, and you will gradually reverse your type 2 diabetes. You don't have to rush to reverse type 2 diabetes. If you reverse your type 2 diabetes in 3 to 6 months, that's still pretty healthy. Again, when people were given very low caloric diet, the body weight came down by 15%, the A1C came down by 19%, the fasting sugar came down by 38%, the serum in fasting insulin level came down, triglycerides came down, the liver cleared out of fat, liver insulin sensitivity improved, pancreatic cell fat also went down, and pancreas also started increasing more insulin. So again, this was a low caloric diet, very important. Again, I don't want you to go on this extreme low calorie diet, but definitely cut the calories in your diet. Again, these are some of the slides. You can review my slides on the YouTube. This is again shows the eating low calorie food. If you eat low calorie food, you can definitely reverse the type 2 diabetes. There was another trial done called Direct trial, where people were given 850 calorie diet, and more than third reversed the type 2 diabetes. So again, if you want to reverse the type 2 diabetes, cut the calories by 500 to 1,000 per day in your diet, particularly if your body mass index is about 25. That will make you lose 1 to 2 pounds per week, and you will gradually reverse type 2 diabetes. Definitely eat whole food, plant-based diet with no oil. Avoid as much animal products as possible. Avoid dairy as much as possible. Avoid oil as much as possible. Definitely no white flour, no white bread, no white rice. And avoid nuts if your body mass index is about 25. This brings us to prevention of type 2 diabetes. You can definitely prevent the diabetes if you have family history of diabetes, if you have a pre-diabetes. So let's see how you can prevent the type 2 diabetes. There was a study done called Diabetic Prevention Program, where people were taken with pre-diabetes, and they were asked to lose 7% weight, just 7% weight. That means 14 pounds for 200-pound person. They were asked to do 150 minutes of activity. That means only about 20 minutes of brisk walking every day. And in that group, there was a 58% reduction in type 2 diabetes. So again, very powerful trial with lifestyle modification. If you just lose 7% of your body weight, walk 20 minutes a day, you can prevent the diabetes by almost 60%. And if you take medicine called metformin, it adds further effects, and you can definitely prevent the type 2 diabetes. In my opinion, if you have type 2 diabetes, if you have pre-diabetes, in my opinion, if you have pre-diabetes, or if you're at risk of developing pre-diabetes or diabetes, definitely get onto the lifestyle changes, which I've been promoting. I have a separate lecture on 6 pillars of healthy lifestyle. Definitely watch that video. Bring your body mass index below 25 for Americans, below 22 for Asians and Indians. Medicare actually covers the cost of diabetes prevention program. So if you have Medicare and if you need to prevent the diabetes, ask your doctor to see if you can be enrolled into this program. Again, when you want to prevent the diabetes, have the goals for weight loss. Try to lose 1 to 2 pounds per week and get your body mass index below 25, possibly below 22. Definitely talk with the lifestyle coaches, which we also can help you. We already have a lifestyle coach starting July 1st. Definitely have an ongoing intervention. Know more about how diabetes happens. Watch my seminar again and again. If you follow all the recommendations I give you, you definitely can prevent the type 2 diabetes. I can guarantee you, I can assure you, if you follow my recommendations, you can prevent the type 2 diabetes. You can reverse type 2 diabetes. You can prevent the type 2 diabetes. Again, this concludes our segment. Let's go through quick reflection. Would you be interested in reversing type 2 diabetes if you have type 2 diabetes? If that's the case, reach out to me, text me on a 517-214-9119, or just message on our Facebook, and we will reach out to you to see help you reverse the type 2 diabetes. My second question to you is, what do you think is the best type of diet for type 2 diabetes and insulin resistance? Do you think it's a keto diet, paleo diet, or is it a whole food, plant-based, no oil diet with minimal animal products, minimal oil, minimal dairy? And again, whatever medications you are on, ask your doctor that are you on all the required medications which are good for type 2 diabetes. Again, this concludes our segment. Again, if you're looking for a coaching program, reach out to us, put in our comment section on Facebook, and we'll reach out to you. This concludes the segment 9. We will be This concludes segment 9. Tonight, I cover segments 7, 8, and 9. These segments will be on YouTube, hopefully tonight, definitely by tomorrow. So watch again and again. If you have not watched segment 1 to 6, watch segment 1 to 6 also. I'm covering this diabetes over 13 segments, almost a 4-hour talk. If you have type 2 diabetes, this 13 segments are must. It's been watched almost by 200 or 300 people already. It's been also watched in India. It's been watched in many of my patients. So again, if you're diabetes, particularly if you're type 2 diabetes, watch all the segments. All the 13 segments are already on YouTube as a one large episode. But if you're watching few segments at a time, watch segment 1 to 6, which are already on YouTube. Watch segments 7, 8, 9, which I covered tonight. They'll be on YouTube late tonight or tomorrow. So watch them also. Again, let's work together. Let's reverse the type 2 diabetes. Let's reverse the type 2 diabetes. Let's prevent the type 2 diabetes. Let's get to body mass index below 25, preferably below 22. Let's have all 6 pillars of healthy lifestyle. Let's support each other. Let's know more about healthy lifestyle. Let's read more. Let's watch more YouTube videos. Again, to give you some other additional thing we are doing this cooking, live cooking shows, healthy cooking. Jayshree has been very instrumental in bringing you live cooking shows. We'll be doing one more live tomorrow. We already did a live with Chef Aajay last Saturday. That's already on YouTube. You can YouTube Chef Aajay Jayshree, and that will give you 5 healthy Indian no oil recipes. Last night we did a broccoli soup. That's already on YouTube on our channel. So subscribe to our channel, Healthy Living with Dr. Aajay Shah. Invite your friends to like our Facebook page. Invite your friends to like our Facebook page. If you bring more your friends, more your family members, we all will be healthy together. This is more like a team effort. I've taken up this mission to make as many people healthy, to make as people live long, as many people healthy as possible. I have nothing to gain. I have nothing to make money. This is truly my community service. This is through my mission. This is through my dedication, my service. So again, if you are interested in this kind of activity, please join our movement. Invite your friends and family. I will end segment 7, 8, 9 tonight. This will be on YouTube. So watch again and again. If you have any questions, ask in the comment section. Thank you. Let me quickly go through what were the comments. There was a comment that thank you, excellent, always something new to learn. There was a lot of comments about thank you. A lot of people were watching it. A lot of comments about how these segments they've been watching again and again. So again, I think it's very important. Type 2 diabetes is a complex disease. Watch all the segments at least 2 times, 3 times if you're type 2 diabetes. Thank you.